Hi, everyone. Sorry for the delay. Thanks for joining us for our next Family Orientation live presentation. Today, we're joined by Molly Herman from the Counseling Center and Allison Rohrbach from the Health Center. So we're excited to answer your questions about how your student can stay well physically and mentally while they're a student here at TU, and the resources that we have available to help them. So to get started, I'm going to have our co-presenters introduce themselves. I'm going to go ahead and start with our students on the call. So Kristen and Aila, do you want to go ahead and introduce yourselves?
Yeah, hi everyone. My name is Kristen Hanley. I'm the Student Director of Family Engagement with the Office of New Student and Family Programs. I'm going into my senior year at Towson as a Family and Human Services major.
Hi everyone, hi families, friends, all of you beautiful people. My name is Nyla Jefferson. I'm a electronic film and media major here in a concentration in radio. I will be graduating this December. I'm a senior as well. Look forward to hearing from you guys.
Thank you. And now I'm going to invite Molly to introduce herself and give a brief overview of our Counseling Center at TU.
Thank you, Catherine. So good morning, everybody. Well, I guess it's not morning anymore. Good afternoon. Welcome to this phase of your virtual family and family orientation. So my name is Dr. Molly Herman. I'm the interim director of the Counseling Center, and I'm also the training director of the Counseling Center. I've been at Towson for 26 years, so I've seen a lot of changes over the years. This is a wonderful school. I'm sure your student will have a great time, whether it be remotely or hopefully at some point maybe in person during their time here at Towson. So the Counseling Center is the mental health provider on campus. We're here to help students inevitably students will experience roadblocks, challenges, just want to grow personally, even if they're not experiencing any particular strong challenges, and we're here for all of that. We are shifting our clinical services model this year, this has nothing to do with the pandemic. This was on tap anyway, to allow for more same-day service. So students will be able to access us pretty much always the same day that they decide they want to reach out for help. We're offering solution-focused treatment so that very day that they call the Counseling Center, they're going to leave with a plan and some idea about how they can work on the issues that they are dealing with. We have a whole array of services, a lot of them online. And again, we were going to be moving in this direction even before the pandemic hit. So it kind of, it fit well in terms of how we had to respond to the pandemic, in that we wanted to provide more online services anyway. So students will be in consultation with a professional counselor. They will have receive recommendations for tapping into any number of the different kinds of online resources that we offer: groups, drop-in groups, peer support, therapy groups, individual counseling, or community referral if it looks like what they need may be something beyond what we're able to offer at the Counseling Center. We're really fortunate to have lots of wonderful providers right in this area, and we have on our website a database that can provide you with information about different community providers. We also offer substance treatment counseling. We have a recovery group called Tigers in Recovery. These are two important things for you to tell your students about. We have a meditation room and a massage chair. So we have those in response to wanting students to just know that a counseling center is a place they can just come and recharge, and you don't have to be dealing with a serious mental health problem in order to benefit from what we have to offer. Those will be available even during COVID-19 by appointment only, and we have systems in place to keep them sanitized, but students can by appointment sit in one of our massage chairs or use our meditation room. We are also launching this summer for the first time an after hours crisis call-in service. It's called Protocol. So 24 hours a day, students can call and get some immediate assistance with anything they're dealing with. With regard to how appointments are going to be happening while learning is remote or hybrid, we will be doing teletherapy, which has worked really well. We've been doing this since March. Students have responded very positively. So what your students should do is just, if they want to get connected with our services, they can either check out our website, because a lot is available just by going on the website. Just go to Towson University and type in Counseling Center and you'll get there. or they can give us a call. We will be staffing our telephones once the semester starts, and they can figure out how to best get connected with a counselor. But we are, in order to maintain safety of everybody involved, we are doing nearly all of our services will be provided remotely. But we are still here for you. We're still able to provide lots of great services, and we've gotten really good feedback from the people that we've been serving since the pandemic started. So we're really confident that we will be able to help your students in whatever ways they need assistance.
Thank you there. And now can I ask Allison to introduce herself and talk about the Health Center?
Hi, everyone. My name is Allison Vorbach. I am the Associate Director for University Health Services at Towson University. So the way that we like to kind of break up what we do at University Health Services is in 3 different areas. And those areas include our clinical services, our health education and promotion, as well as our public health aspect. So the thing that you should know about the clinical services is that we are really the place that your student can go on campus if they're sick, if they have cold, flu, sore throat, pink eye, you know, they have an injury, any of those kinds of things, they can come in and see us. We are staffed by 4 or 5 physician's assistants, and as well as a nurse practitioner. So they can come in and see us for all their healthcare needs. We want them to use us for their primary care, to come in and see us. We also have, we can do things like preventative care, so physicals, annual exams for women. We have a lab, so we can do blood work. We also can do things like allergy shots and immunizations and all those different types of things. So lots of different services for your students while they're on campus, and it's for all students. So whether or not they're commuters or they're living on campus, they can come in and see us. We do bill health insurances. So on our website, there's a list of the health insurance companies that we're currently participating with. We participate with most major health insurances, including Medicare. Including Medicaid. And then also, I always suggest that parents call the phone number on the back of their insurance card, just so that they know if their students if their health insurance will be participating with us when they come in to see us. We will see students no matter what, but the student should always have their health insurance card with them when they come in to see us. The other thing is that we handle the public health on campus. So that's the immunization requirements. So if you've already watched the video, you'll see that we do have immunization requirements for all students, whether or not they're commuting, living on campus, graduate students, whatever that may be, or transfers as well. So we require students to have proof of 2 MMR vaccines. One of those vaccines, the first vaccine needs to be after their first birthday. The Tdap vaccine, and it's important that the P is there, that's the pertussis. So it's not the same as the TD vaccine, it's the Tdap vaccine, and that had to have been given after 2005. And then also students who are living on campus need to provide proof of their meningitis vaccine. So either proof that they've had the meningitis vaccine, or there's also a waiver that students can sign. I will say that we highly recommend that all students, no matter if they're living on campus or off, have the meningitis vaccine. And then the other piece of it is the tuberculosis risk screening questionnaire. So what you'll see on that video on how to upload your immunization forms, there's also a part on how to do the tuberculosis risk screening questionnaire. So there's a form that you can download from our website, and you can take that to your doctor, your child's doctor, and the doctor can fill out the dates of the different vaccines, and then also sign it, and you can upload it into our medical records that way, or you can get a copy of your immunization records from your doctor, and you can upload those as well. So it doesn't have to be our form, but it has to be a form that has the dates of those immunization requirements. And I will say those are due by August 15th. If they are not turned in, the student will have a $35 fine put on their account, as well as a hold for registration for the spring semester. So it's very important. It is a requirement. I think that's it for now, but if there are other questions, feel free to let me know.
Thank you. I think that's a great overview of what's going on over in Warden West. So I have some questions for you that are pre-submitted. So this one is for the Health Center. Can you talk about the flu shot program at TU? Can a student get a flu shot?
Sure. So students can get flu shots with us. we usually have them in around the end of September, give or take, sometimes earlier, sometimes a little bit later. They can get them done at the health center. And then the other great thing that we've been doing through our health education team is going out and about in the community. So I'm not sure exactly how that will work this year with COVID and everything, but in the past we've been able to go to, areas where students are and be able to provide the flu shots that way. So almost like flu shot clinics that have been traveling about campus, but they can definitely get them in the health center as well.
Thank you. And then the other one I have for the health center is if a student suffers from a chronic condition, should they alert your office before coming to campus?
Sure, I think that's a great idea for them to alert the health center. And the best thing for them to do would be to call our main phone number, which is 410-704-2466. And the person at the front desk can get them in touch with our clinic coordinator, and our clinic coordinator can get all of that information, maybe have some paperwork faxed over to her, and she can upload everything into the student's chart. So that way we have an idea of, what's going on before they come in and see us.
Great. Yeah, that sounds like a great preventative measure there. I do have one for the counseling center. If a student has a relationship with an existing mental health provider, can they transfer services? Should they transfer services to campus?
That's also a really good question. I think that's one that would really depend on the particular situation. So especially now that all counseling is remote, it might make the most sense to just stick with the therapist if they have a good ongoing relationship already with their therapist. We are also able to provide limited individual counseling up to 8 sessions per year. So that's something that, although we do have lots of other services as well, what I would advise is for them to talk about it with their current therapist, see what they think, and then they could also come in and just have a meeting with us to talk about what resources we provide that could supplement perhaps what they're getting with their therapist, or if they wanted to switch over for any particular reason, they could certainly do that.
Excellent. Thank you. I'm going to go ahead and have Kristen open the chat. So we will take questions at this time. If you navigate to the chat function, you'll be able to type them in the box, and then we will ask them to our presenters here. And in the meantime, Naila, have you interacted with the health center or counseling center? What has your experience been like here?
Yes, actually I have. My freshman year, I have Kaiser Permanente. So my insurance is not accepted at the Health and Counseling Center. However, there are free things that are offered to all Towson University students, despite them having insurance or having the funds, which is including free testing, counseling sessions. I have seen and had several counseling sessions for free on campus. I have utilized the meditation rooms to meet with other students because it is a safe space for those who are trying to focus on their work, especially during finals where other places are a little bit more crowded. They also have different support groups as well as peer mentorships. So my roommate actually was a peer sex educator and worked with several students who had different stories, different backgrounds. I have another roommate that was working with those who were also recovering. And these are students that have been there and done that. And they're just a helping hand along with professionals to make the transition from, wherever they're coming from to a more stable in mental health here on campus, because we don't want to forget that along with all the academics.
Yeah, that's a great point that there's a lot of peer groups in both the health center and the counseling center so that students can work with other students. I'm seeing a good number of questions in the chat. Thank you all. So Kristen, you want to go ahead and get started?
Yeah. So I see a lot of questions about COVID-19. So does the health center have any available testing for COVID-19? And if so, how will you be handling students who might contract COVID-19 or in that nature?
So I want to just let you know, our director from the health center, Matt Goldstein, is actually on the line as well, because I had a feeling we were going to get a lot of questions regarding COVID. And I would say without a doubt, he has become the COVID man, the expert on our campus. So I'm going to let him answer. I've seen a ton of questions that have come up, Matt, about COVID and about what we will do if someone becomes positive, what will happen in that situation, if we will have if the vaccine becomes available, will we provide it, that sort of thing. So do you mind answering, Matt?
Sure. Okay. I knew there was a reason for me to be here. So, yeah. So, first of all, welcome to everybody. So, yes, there are many COVID plans in place. So, if you drove through campus lately, you would see a large tent outside of the health center. We have been doing sort of mass testing there for the campus community to ensure that people who are coming back to campus are safe and not bringing anything with them. So we have been testing many people as they come back to campus, faculty, staff, and now some students. So if somebody is positive, then obviously, just like anywhere they might be, they go into what's called isolation. And then we start looking for who contacts of that person might be. So who was in close contact with that person. And then we try to get those people into what's called quarantine if they're exposed. We work together closely with the health department to make sure that on campus and off campus contacts are well vetted and that we're able to reach out to everybody. If someone's in the residence halls, there's a elaborate plan in the residence hall. There's, as you all might know, there's reduced amount of housing on campus. And so if there would be a case on campus, there is a special space that's set aside, about 90 rooms, that are going to be just for people in isolation and people who are sort of high-risk exposure, so that they are sort of moved out of the general population where they can be taken care of, whether it be their medical needs, their food needs, any needs that they have, so that they don't have a need to go out and expose other people to COVID. So yeah, so those are good questions. I'm happy to answer more. We've kind of been living this since this started, and it's something we feel we're prepared for. So let me know what your other questions are.
So Matt, I will add, I saw a couple of questions about testing and that sort of thing. So this is an ever-changing process. Things change every day. There is as of now, there will be, we think that there will be testing available in the health center for COVID. But again, you know, this is an ever-changing kind of scenario. And then there's a question about whether or not students will be mandated to get tested when they come back to campus. And the answer to that is no, correct?
Correct. So no one's mandated to be tested. The testing is sort of coming from the perspective that if you test a whole lot of people, you sort of get signals to hot spots, if you will. And so that's why it's an optional testing. So it's something that we have available now. We don't have any plan to take down that tent anytime soon. I do know that there was a question about immunization, about if a vaccine comes out. We've actually been rehearsing and doing the testing as a way that we could prepare for giving mass vaccines. So we have the testing down now to 10 people every 10 minutes. And with that model, I think that testing takes longer than giving a vaccine. I think we could vaccinate probably 20,000 people in 2 weeks. So that's what we've been preparing for. That's what we've been scaling up for. So as soon as we get that drop of vaccines, we're ready to go. And so that's sort of what we've been rehearsing every day with the tent. Again, right now we're doing it with testing, and the minute a vaccine becomes available to us to give out, that's our goal, is to be able to do it rapidly.
So another question I see about COVID-19 is, how long does testing take to get the results back?
Tough questions. Okay, so the way it works is there are rapid tests, and then there are more elaborate tests. And the rapid tests, as it sounds, you get the results back in about 15, 20 minutes, some 40 minutes. The question is, if somebody has no symptoms, what does that answer mean when you have a pretty significant rate of what they call false negatives? So does that mean you're a false negative, or does that mean that you don't have it? And so we've sort of shied away from using the rapid test. So that takes us to the next test. So you may have heard on the news that testing has been taking a week or so. Those are send outs to sort of national labs. We have a partnership right now with the University of Maryland Pathology Associates Genomics Lab downtown, and they've actually been testing our specimens. Generally, I get the results back the next, how do I say this? So the test I did on Monday, when I walk into my office at 7:30 tomorrow morning, they should be there. And they probably came across my computer by 1 o'clock in the morning, this morning, or tomorrow morning, I should say. So we have been getting the results generally within 48 hours. Sometimes the test needs to be run manually, and so we've had some trickle in after that. But let's say the 40 tests that went off yesterday, I should have probably 35 results back tomorrow morning. So it's pretty quick, which actually gives us the ability to do the work that we need to do with those results. So unfortunately, when you go to a public testing site and the results come back a week later, let's say, it's kind of too late to do anything a week later, right? So we're very fortunate to be able to have the courier pick them up through the labs at 3 o'clock in the afternoon and bam, start running them downtown.
Some other COVID follow-up that I see earlier in the chat is about preparing to come to campus. So is the expectation that students will self-isolate prior to their arrival to campus? And will symptom checking be required of folks before they enter our campus community?
Okay, excellent questions. So as far as self-quarantine when you come back to campus, currently in Maryland, they don't have a self-quarantine. They lifted those restrictions. Again, they might add them back knowing now that there's some hot spots flaring up in the country. So I wouldn't be surprised if in the next few weeks we joined in other states that sort of make people self-quarantine when they come from other areas. But to my knowledge, most recently when I checked, that wasn't the case in Maryland, that you had to self-quarantine. As far as students doing symptoms tracking, that is something that because we haven't brought back the entire student population and we just started bringing back faculty and staff, we're sort of beta testing the tracking system right now. It was kind of a homegrown system at Towson. So that's right now being tested on a small population of students and on faculty and staff. And I would not be surprised if the expectation wasn't to symptom monitor on daily for students as well, but I can't tell you for certain right now.
Thank you. I know we have a lot of non-COVID related questions too. So Kristen, do you want to throw some of those out there?
Yes, absolutely. So is there a pharmacy on campus?
Okay, I can get that one. So we have what's called a dispensary in the health center. So what that means is that we have some medications in our dispensary. I like to say more the basic kinds of things. So we have lots of different antibiotics. We have Mucinex and, things for your sinuses and inhalers and that type of thing. So unlike a pharmacy though, you don't use the student wouldn't use their pharmacy plan like they would at like a CVS. So if a student wants to get the medications through us, they can, but that would be billed to the student's bursar account. And I will say that the prices are not, you know, outrageous. I mean, you know, we have Z-Packs and amoxicillin and things like that I think are somewhere between like $10 to $15 to get those. If you want your student to use their pharmacy plan, I will tell you that there are many pharmacies nearby. There's actually a pharmacy that's 2 blocks, what our students call Uptown. They all know where it is because it's towards the bars. So they all go up that way and they know exactly where that CVS is. And that's, so our providers can write a prescription and send it there if they want to use their, prescription plan. There's actually some pharmacies as well that will deliver to the residence halls. So that's an option as well.
Thank you.
To clarify, does that mean medication won't be delivered to the health center? It will be delivered directly to the student?
Yes, if it's a delivery from one of the pharmacies on campus, or off campus, they will deliver to the student, not to the health center.
Thank you.
Another question we have is about a healthcare directive. So if a student has a healthcare directive, should it be sent to the health center?
So we don't take healthcare directives per se. You know, we get a lot of questions from parents about wanting to have all information about their students' medical records. And that's just not something that we do. Everything is on a case-by-case basis. So you can imagine that there are some things that students will be fine to let their parents know that they're coming to the health center for. And then there's some things that they don't want to let their parents know that they're coming to the health center for. So there's no blanket kind of open policy of here's your child's medical records. I will tell you, for issues, I know parents worry a lot about, like, if there's an emergency, how would we be contacted, that sort of thing. So it's really important through registration that you make sure there's an emergency contact for your student. So if your student is taken to the hospital, or there's an emergency, or they are incapacitated in some way, they aren't able to speak, or there's something that's serious, we would absolutely contact you. But this is not something that we would contact you every time they're in the health center. That would be for emergency type situations. So if there's something that they want us to talk to you about, we absolutely will, but that doesn't give us kind of this blanket open policy of getting all of the medical records, if that makes sense.
Yes. And similarly, in the light of an emergency situation, if a student is feeling very ill and doesn't feel like they're able to walk to the health center, but also doesn't feel like they need to call 911, what would you suggest how to handle that?
That's a good question. I would always suggest that students are sent to campus if they're living on campus with things like the basic kind of healthcare needs. So a thermometer, especially in this, with this everything going on now, but a thermometer, some Advil, some Motrin, some Tylenol, that sort of thing. So kind of be able to monitor their symptoms. We don't go out so we don't leave the health center to do any, medical, being able to see students for any of their medical needs. So I would just suggest that maybe they monitor their symptoms, but the best thing for them to do would be to try to get up to see us in the health center. There is the shuttle. I know a lot of students, like their friends can drop them off and that sort of thing as well. So it's probably best to come in and see us. But if they're too ill, they, and if they're so ill, they may want to go think about going to the hospital if it's that bad.
Also, can I add to that? So if students are living on campus, they have what's called a residential assistant or an RA. And RAs can also make some accommodations with transporting students to the health center. Also, like it was mentioned earlier, there are on-campus shuttles that run until 2 a.m. in the morning. So you don't have to worry about walking anywhere. Also, we also have TUPD. That are on call as well, that also provide transportation to the health center if in case of any emergency. So they're always on call as well and have the capability to coming to the student's dorm and assisting them with getting that medical service. So there's that as well.
I could also add, I lived in a dorm my freshman year at Towson, and there were times when I just woke up and I wasn't really feeling well, and I just wasn't feeling too great. But kind of like what Allison mentioned, just having basic medicine around, Advil, Tums, Pepto-Bismol, just like basic medicine to kind of watch your symptoms and monitor yourself, and having those around can help you to like determine whether or not you can go to class, you can make it to the health center, how you're feeling. Just to have those around is very helpful for living on campus. So another question that I'm seeing is about not being insured. So if a student has insurance that is only covered in their specific state, is there a program that Towson University has to cover someone in case they get sick, or if something happens? Is there a program for that?
Well, the first thing I want to emphasize again is that we will see students no matter what. So I don't want anyone to think that just because their health insurance may not be covered with us that that we would not see them. The best thing for that student to do would be to do what's called, at the front desk, tell them that they want to do the, and I can't think of the word at all, maybe Matt can jump in here, but it's called prompt pay. That's what it's called. Sorry, it's been a while. To do prompt pay. And what that means is that the student would sign that that either they don't have health insurance, or that their health insurance isn't covered with us, and that they could do what's called prompt pay, and they would reduce the price of the visit. So, it would make it a lot more affordable for students that way, and then they can get that billed to their bursar account as well. So typically an office visit with insurance is like $70. So I think it might knock that down to like $35 or $40 or something like that. But that would only be for students in that situation. They have to sign that's the case with them. The other thing I will add really quickly is that we do have a health insurance plan through the university, through Aetna Student Health. So if your student does not have health insurance, they can get it through the Aetna Student Health Insurance Plan. You just go to aetnastudenthealth.com, pick Towson University from the drop-down menu, gives you all the information about how to sign up for the plan, the cost, all that sort of thing. So that's another great option if students are not insured.
One add-on to that, because it was asked in the financial aid and bursar live session, is that you don't need to opt out of that health insurance. No. Some institutions have you opt out. We don't have that. So they only need to opt in if they need that insurance.
Also a financial question. So if a student, is a student able to use their parents' health flex spending card if the student is listed on their health insurance plan?
So we cannot use the flex spending card in the health center. We can, however, provide a bill and a receipt for students, and then they can provide that to their flex spending plan and get reimbursed that way. So we've had students do that, or their parents help them do that, but we can't actually do the flex spending in the health center.
I have a follow-up question to the medication shipping. So if a student needs a refrigerated medication, could that be shipped and stored at the health center? I'm guessing maybe administered at the health center too.
Yes, if it's something that needs to be administered with us, we do have a refrigerator that we can store students' medication. We just need to know ahead of time and have like have the physicians kind of order and information. So we know exactly what it is. So we do this a lot with allergy serums as well. So we can store allergy serum. We just need to get basically the form and the information from the physician that says how often they get it, what dosage, that sort of thing. So we can definitely do that.
Here's an interesting question that I haven't seen yet. Do you all have a recommendation for a specific thermometer for students?
Matt?
I am told, which may not be true, but I am told that every student is going to get a welcome back packet, which includes a digital thermometer. So you might want to hold on that purchase until you see what comes in that happy little goodie bag.
That is my understanding as well as some masks and hand sanitizer. I have a question for Naila. So with Burdick Hall as a reference point, so that central campus, how can folks find the counseling and health centers?
Okay, so everyone likes Starbucks, and Starbucks is on the corner across from Towson University on York Road. And right next to that Starbucks used to be the Marriott Hotel, which is now turned into a dormitory. And right across from that is the health center. The health center from Burdick, if you're walking from Burdick, they're doing some construction right now, so it's kind of a little detour. You're walking past the Towson Town Garage and the LA building, which is this big, huge glass building. You just keep on going straight. It's a straight shot. You're gonna pass this huge field, and then on the left is going to be the health center. Also, what Matt was saying about the welcome package. So I stay on campus currently, and I received one. And these are the thermometers that come inside of the package. So if you like them, you like them. If you don't, you don't. It's all up to you. But they work fine when I tried them out, and they come with about 10 or so. So it's totally up to you. Did that help?
Yes, thank you.
Can I just add one more thing? Sorry.
Yeah,
I just, when you're talking about the location and everything. So the thing I think that's really awesome about our model is that the health and counseling centers are in the same building. So the health center's on the ground floor, and the counseling center's right upstairs from us, which is really great because if we need to do referrals or walk someone upstairs, or they need to walk someone down to us, we're together. And it's nice when you think of it in like a wellness model of like the physical and the mental and emotional health kind of, we're all in the same building. So we are all in that same building that she was describing.
I have a question for the Health and Wellness Center. So is there a specific time that you think is better to make an appointment with you? Like, is the morning more busy, or the afternoon, or right when you're about to close?
So you may be really surprised about this, but we are not super busy from 8 to around 10 or 11 a.m. That's because all of our students are still sleeping. So that is when we are the least busy. I always tell students, so we do accept walk-ins for minor kinds of things. So colds, flu, sore throats, pink eye, that sort of thing, not like a physical or an annual exam or anything like that. So the best thing to do would be to call as early as possible so that we can get you in as early as possible. Most of our students like to make their appointments via the web portal. So there's actually a web portal that's tigerhealth.towson.edu, and students can make appointments that way, or they can call us, or they can walk in. It just know that if you come in at 4:45 and you tell us that you're dying at 4:45, we may not have any appointments to be able to see you at that time. So it's best to come in as early as possible. So we always ask families to make sure you tell your student, because they're probably going to call you first and say, Mom, I'm sick, or, and say, get into the health center early so that they can see you.
I would say it's something similar for the counseling center. We have the least amount of traffic in the mornings, so that's often a good time to come in. Coming in right before closing is probably not the best time to come in. We will certainly provide assistance as needed, but it's best you'll have much more choice about what the different services you might access if you come in earlier in the day.
I do have another question for the counseling center. So if a family is worried about their student who is experiencing a different college than they thought they were going to get and might be dealing with some feelings of isolation and like they're not connected because they're coming from home. Do you have any suggestions for a family that's handling that?
So yeah, I think that's that feeling of just how to get connected is probably one that a lot of students are going to be experiencing, whether or not Towson is a place they're really excited to be attending or whether this wasn't really in their plan. So we are, we'll be having a lot of, as I mentioned, drop-in groups, peer support groups. I think that's a great way to try to get connected and hear other students who are maybe dealing with some of those same difficulties during this pandemic. We're all going to be trying to think of creative ways to get connected. And also student activities would be a good place for your student to check out. I think just getting as involved and as connected as possible, using all the resources that are going to be there is probably the best way to manage that.
Thank you. Yeah, I know there are a lot of unknowns here.
So the counseling center, and the health center, is there going to be, so since Towson is a mask on campus, will you be having, everyone will have masks on during individual counseling appointments or health appointments, correct?
I'll go first. So for the counseling center, we are actually, because masks would be absolutely essential for an appointment, and because it would be very difficult for us to really have the kind of connection and communication that you would want with a mask covering half your face, that's another reason why we're going to have nearly all of our services be conducted remotely. In the very rare instance that an in-person session was essential for some reason, then yes, the student and the therapist would have to wear a mask, and they'd have to be pretty far apart from one another in the room. So that would be a less ideal way to do business.
And everyone in the health center will be wearing masks.
I'm seeing a question about how a student should convey insurance information to the health center.
So two things. First of all, you will see on the video that there is actually a way to upload your health insurance card in the web portal. So when you're uploading your immunization forms, you can also upload the front and back of your health insurance card, which I would highly recommend. And then the other thing is that your student brings their health insurance card with them each and every time. So when they check in, they're going to have to see one of our billing specialists anyway to kind of go over everything with them. So that's the way that happens, is that they meet with our billing person, we get all the information, and that's how everything's billed.
Thank you. This is for the counseling center. Are there places on campus that you know of where a student could have their telehealth counseling appointment if they're in a shared residence hall room? Do you know that if there's spaces set aside?
That's a really good question, and that's exactly why we are creating that option for students to come into the center if they don't have access to a private space, or they don't have access to the technology that they would need. So they should just give us a call and we can set them up right in the counseling center for that.
Great, thank you. Well, before we move to our closing, I'm going to ask both the health center and the counseling center, if students need to get in contact with your office, what should a family tell them that is the best way to get in touch with you?
Well, for us, it would be calling us. So our number is 410-704-2512. And rather than have to memorize that or write that down, you can also find that very easily on our website, which also gives instructions on how to contact us.
Thank you.
So the best way to contact us through the health center is either by calling us at 410-704-2466. And remember, hours are very limited in things right now. So right now and throughout the semester as well, we have an email address that's healthcenter@towson.edu. And we have dedicated staff who read these emails. We get tons of emails from students every day with questions. So that's a great option as well. And then I will add that on our video, Matt and I both have our contact information, our direct contact information. We send that out in case you all as parents and families and caregivers, if you have specific questions for us, if, you know, especially COVID questions, I shouldn't say that, but for Matt, you know, this is definitely Matt's wheelhouse, but I can answer, you know, any kind of question you may need about resources, things that we can do in the health center. If you're nervous or worried about anything, feel free to contact us directly.
Thank you. And as you want to learn more, not only about the Health and Counseling Center, but about your students' experience at TU, we are continually posting resources to your page, the families page. So if you visit towson.edu/families, that's families plural, you'll find things like these sessions being recorded, they get uploaded there. All these folks have made us informational videos so that you have access to recall any information that you need. Those videos are posted on that website, as well as the schedule for the rest of our live sessions. So we have yet to cover housing and residence life. I know there are tons of questions about that. We have a session coming up about that, about campus safety. If your student is a member of the freshman transition program, we'll have a session specifically for you this Thursday. So continue to engage with these live sessions. We're happy to answer your questions. And we hope that we'll be able to provide lots of resources for you on that towson.edu/families page. The two things on that page that I want to highlight for you are our family newsletter. So there's a link right at the top of that page for you to start getting information from TU. And then there's also a link to join our Towson Family Network. So in college, most folks are past the PTA days, but it's as close as we get. It's an organization of families who want to support Towson University, and you get a couple perks by joining, but there's information about that organization on the website as well. So we hope that you'll continue to work with us as we try to help you support your tiger, and have a great afternoon, everyone. Thanks all.